We are here in Kuala Lumpur, Malaysia. We came for a little medical tourism. We just had health screenings done at Prince Court Medical Center, and we are going to tell you all about it. I'm Rob.
And I'm David.
We are 10 degrees warmer, and we are going to walk you through our screening of what our experience is like. We're going to give you a few tips and let you know a few things we wish we had known before we got there. There is a lot of really good medical care all around the world.
Definitely.
And some places are just better set up to help a expat kind of navigate through it. Kuala Lumpur is definitely one of those places. So here's what you can do is you look at the hospitals and they will often have like a health screening package, and they'll have different packages you can look at, and you can look exactly through what they cover. You know, they kind of give an age range to give you a rough idea of what you might want to choose, although you can choose any of them at any age. We looked at the signature. It's roughly indicated for people who are over 50. It has a lot of tests. It is also the most expensive.
Most comprehensive.
And the most comprehensive. And we'll talk about costs at the end, but it is much more affordable than you think it's going to be. It's probably a little bit overkill for our needs. We're pretty healthy, but also it just seemed like a really nice way to get a baseline done at a very reasonable cost, all done in one day. We did look at a couple of other hospitals, both here in Kuala Lumpur as well as up in Bangkok. And for the price and for the tests that we wanted to make sure that we got, this here at Prince Court was our best option. When you're ready to make an appointment, it is very easy. You can just go right to their website, look for their health screenings, and you can make an appointment right there and then. We came to Kuala Lumpur and we had 8 weeks. We thought it was going to be really easy based on conversations we'd had with other travelers about getting an appointment. And then when we actually got here and went to make the appointment, they were all booked up the entire time that we were here. I think they're getting more popular. So what we did then is we just went directly to the hospital. You could probably give them a call. We just walked over, we asked for an appointment, and they made us an appointment there on the spot for, I think it was 3 business days later. So if you can't get in online, it's very easy to do it that way. But if you can't, just go into the hospital, make a call. They clearly have more appointments available than what shows on the website, and we were able to get right in.
So our day started pretty early. Our appointments were at 8:15 and 8:30. Getting to the hospital is not a problem. It's very close to Bukit Bintang. We did take a car, although walking from here, it would not be that difficult either. The hospital is modern and beautiful and new.
Yes.
Getting in, you'll walk through the main lobby and there is an information desk right there in the middle. Usually it was staffed, so you can ask any questions there. But if you're going to do the screenings, you just turn left down the hall. About 2 doors down on the right, you'll see the big sign that says screenings. It's very easy to find.
We did start out trying to take some video while we were going through this process, but it just felt too awkward because there were other patients around us and we didn't want to get video of other people. It's very easy to get around and navigate through the hospital. Once we went to check in, there was several different people at the check-in desk, and they all spoke English. The doctor that we talked to and like the nutritionist, those people who speak a lot with patients, their English was really, really good. Some of the ancillary stuff, everyone spoke English really well, but a lot of them were wearing masks. Sometimes it was a little bit more of a challenge to understand them, but we didn't really have any issues.
No, and the instructions are quite basic and easy, so it's easy to follow along. Now, when you get there, you're going to need your passport, and you'll fill out very minimal paperwork.
Yeah.
It's nice. Very simple, easy process to check in.
Once we checked in, we waited a couple of minutes, not that long, and then right away you start the process because it's a lot of things that you're going through.
The first thing we did was give blood and urine. So another tip is they will have you fast for 8 hours before your appointment, which is easy if you have an early morning appointment like we did.
Yes.
Be sure to drink plenty of water because that will help with giving blood and with the urine.
Right after that, they started us out on like a sling of tests.
Yeah,
so,
one after another.
Yeah, we got our blood pressure taken. We did a pretty simple eye test.
We did a hearing test.
The hearing test was fun. Like you go in a little soundproof thing and with headphones on and click the button when you hear something.
We did a body fat index machine.
And then we saw the doctor for the first time. So he kind of just went through and took a basic history with us, so he knew what we were looking for. If you do have any specific concerns or something you want them to pay attention to,
This is the time.
this is the time to talk about it. They've got their whole agenda and they're just going to do that regardless. But if you want anything special, let them know what's going on.
He'll also check your eyes and ears and throat and all of that right at that point too.
So he did give us a time at that point where he said, you're going to go finish the rest of your test and then come back here at 2 o'clock. Then, he's going to go through all of the results with you, which really is the highlight of the day.
Yeah.
So pay attention, because he kind of just sort of said it, but then we needed to know that for later.
Yeah, so that's another tip.
Yeah.
You will be well guided through this process. Everyone there knows what step is next and can help you get to that next step. But do also pay attention, because there are a lot of instructions being given to you.
So after we met with the doctor, we got taken over to do our stress test. So first they did a resting EKG, and then they kind of strap everything to your chest.
Lots of straps and
wires
buzzers
and stuff.
yeah.
And then you get on the treadmill, and we were on the treadmill, I don't know, 10, 15 minutes. It wasn't really that long. And you start out walking, and then every 3 minutes it gets a little bit faster. And you go through the test to see how your heart is doing. This is probably my favorite part of the day.
Yeah, so another tip here is they say bring a change of clothes so you can do the stress test. Not necessary.
Yeah.
Whatever you're wearing, you're not going to sweat that much. It's not going to... Make sure you have good shoes for it, because
Yes.
you're moving quickly.
And you want to be wearing active clothing to be able to handle it.
Stuff that'll move, but
We didn't
we
need to
didn't change clothes.
And then where did we go after that? So then they came and they gave us more little pieces of paper to tell us, where to go. Keep a hold of those papers, because you need them to turn them in, but also on the top, they will tell you the directions on how to get there.
And very specific, it'll say, take the middle escalator, turn right.
Yeah.
Elevator, turn right, walk to the end of the hall, past this place.
Yeah.
They're very specific.
So next we got chest x-rays done, and then we did the bone scan.
Bone scan and
the ultrasound of the abdomen. And that was also very interesting. Is there, you lift up your shirt and they've got the ultrasound with the gel, and they're just looking at all your organs and making sure everything's in the right place and is the right size and all that kind of stuff. So again, this was a part that I was really looking forward to, because you don't often get that information of how your organs are doing. Everyone we worked with was very good and chatty and kind of would tell us what they were doing. It was a good experience overall.
After that, we were sent down to the other end of the hospital for
Yes.
eye tests.
Like you start to forget all the
There's
things
just
that
so
we
much.
did. And these are the tests where it's not like a vision test, but they're looking at the nerves in your eye and making sure, that you don't have glaucoma or something like that. After that, then we went to lunch. So you do get vouchers that are good for 20 RM, which is about $5, to go down. There's a couple of different places that you can eat. We went to the main cafeteria. Once you sit down, there's a little barcode. And so you do need your phone to work. They do have Wi-Fi at the hospital that you can use, but you take a picture of it, it brings up the menu, you order, and they bring it directly to your table. So it was very easy, very nice.
Yeah. And that's quite a long break there between your final test and the next time you have to meet the doctor.
Yeah.
Your lunch break is a couple hours.
We had like 2 hours, I think.
2 or more hours.
We talked to other people, and depending on what your times are and how long you have to wait, you might not have that long of a break, but I think because we were first in the morning, we had a pretty healthy break there. But we just kicked back, we enjoyed our lunch.
So bring something to do, because
Yes.
you have a little free time.
The lobby of the hospital is beautiful. We sat there for a while and just chatted, so that was very nice. And then we went to the dietitian. She actually had access to all of our results. And so she didn't want to give us any of the results except for the ones that were directly related to nutrition. So she was looking at our blood panels and was able to say, this is what your lipids are, this is what your kidneys are doing, and be able to give us very specific advice depending on what our blood work looked like. So that I thought was actually pretty helpful.
Yeah.
We both need to eat a little bit better. That's not a surprise, I think, as we're eating all this delicious fried food over here in Asia. After that, we went back up to the main waiting area and went to see the physician. Now, one thing I should say, because it's one of those little bit awkward things as a gay couple when we're filling in our paperwork and it's like, who's your next of kin? What's their relationship status? And, emergency contact things. And we're in Malaysia.
And marriage is not legal here for
Gay marriage is not legal. So we were like, what should we do? And we were like, we'll just be honest, it's an emergency contact form. They're not going to need us. So we just put everything down. And then when we went in to see the doctor, he's like, do you want to come in together? And I thought that was really nice that they never addressed the issue at all, but they treated us like a couple. I appreciated that.
Definitely.
But then, so we went in, the doctor, this is by far the best part of the day, is he sat down and he had a stack. Do you want to show him the stack of papers? Had a stack of all of our results from the entire day. And he just paged through everything with us.
It is just
let us know.
Pages and pages and pages.
Yes.
Plus your EKGs and everything are in here.
Yeah.
Every result, every test.
So he went through our blood work, went through every value. And of course, most of our stuff was normal. We didn't really have anything that exciting to find. But even hearing things are normal is really nice to know. Like when they went through, the cancer screenings, it's good to know that all of our things are negative. They took hormone panels and knowing, what our testosterone is and what our prostates look like.
Any
and
blood
all
diseases,
of that kind of
anything
stuff,
we knew.
that our hepatitis A and B, we've both been vaccinated in the past, but knowing that those vaccines are still strong in our body and we still have protection, that's all good stuff to know.
Yeah.
And the fact that he was willing to sit there and go through it, it's not like what happens in the United States, where the physicians in the United States, it's just the way the system is set up. They've got 4 minutes to spend with you. So they're going to go through and they're going to tell you the major things, and then they got to move on to their next patient who's already waiting. Here, this is much more like a concierge situation where that doctor was with us half an hour.
Yeah.
And we did not feel rushed at all. He was
and he
asking
writes
us if
up
we
a
had
really
questions.
good summary of all
Yes.
the major things that he noted.
It's a really good system as far as being able to get that one-on-one attention with a physician and being able to ask your questions. So here's another tip that I have for you that we didn't really prepare for. Be ready to ask questions. Because especially if you're from the United States, you're not used to having that luxury, and you really do here. So if you've got questions about any of your results or follow-ups or any of that kind of thing, be ready to ask it because you're going to have the opportunity and you might as well. I wish we had kind of thought about it beforehand, and I don't think we took as full advantage of it as we could have because he was so friendly and willing to spend that time with us.
And so at this point, if you need more beyond the tests that are given, say a dermatologist or a knee doctor or something specific, this is a time too when he can make those referrals for you.
Yes.
And you can make those appointments maybe not get the appointment same day, but you can make those appointments as you are leaving.
Yeah, so once you leave him, you just go to another desk and you can make whatever appointments you need to make. We've talked to a lot of other people who have done these and they just went down and made an appointment with whatever doctor they needed to get. They got in within a couple of days, if not the next day. It's all very easy. The costs are very transparent, so you know how much you're going to have to spend for different tests. It's really a good system.
Yeah.
Now, I think, people like to talk bad about healthcare in America. I'm a nurse. I get that there are challenges, but I think you can get some kind of this care in the States. There are concierge physicians who will work with you this same kind of level. They don't take insurance and you have to pay out of pocket. Now, the difference here in America is that even if you have that concierge physician in the States, you're still going to have to make all these appointments. And that could take who knows how many months.
What we did
Yeah.
here would have taken months and months in the States to accomplish.
Yes.
And we would have had to pay the deductible on
Yeah,
each of-
every single time paying all those deductibles probably would have added up more, even with insurance, than what we paid here out of pocket. So here's another good tip when you're getting ready to pay. So for us, doing that signature mail package cost us about $410 each. However, big tip time, if you pay with a MasterCard, you get a 10% discount. They will accept Visa cards or American Express cards as payment, but with a MasterCard, you get a 10% discount, which is huge. So we, luckily someone had told us that, we brought our MasterCard, and so we ended up paying about $375 US each for this day of testing. I think it was very well worth it.
Yeah. And so you'll both, at the end, as you check out, you'll get a hard copy of all of your results. Plus, they can email you any of it also.
Now, they don't email it automatically. You just have to ask when you check out. We were like, can you please email this to us so we'll have, access to it later? And she was like, sure, no problem. And then for your imaging, they do give you a link. We haven't actually tried to look them up yet, where you can go in and download all of your imaging. Overall, this was a great experience for us. I'm so glad we were able to do it. We've got a very good baseline now.
This will give us peace of mind for quite a while now. We can just
knowing things are okay, that we don't have cancer. Because we have talked to people who have come to these just thinking it was a checkup, and then they found stuff, and they found breast cancer, or they found heart blockages. We talked to one guy who went in, and that afternoon he was getting heart surgery. So it can be really
a lifesaver,
a life-saving thing if they do find something. But even if they don't, it's a good baseline. I think there's nothing to regret of us doing it. If you are looking into it, I think this is definitely a good place to consider. We did look up in Bangkok and we looked at a couple of other hospitals, but for what we wanted and the price we wanted to pay, this was our best option.
Yeah. If you found this content helpful, please hit the like button and subscribe if you would like more information on long-term travel.
Today and not tomorrow.